So, imagine a massive car crash. Like, the physical forces involved are just immense. And all that kinetic energy, well, it has to go somewhere.
Right, yeah, it doesn't just disappear.
Exactly. When a human body absorbs it, it leaves a very specific, undeniable record. So, welcome to today's deep dive into the mechanics of trauma. Today, we're taking a stack of medical notes and legal statutes and decoding the clinical reality of mechanical injuries.
Yeah, specifically we'll be mastering abrasions, which is huge for those of you tackling forensic medicine right now.
Yes, absolutely. But, to really understand this, we have to recognize that doctors and lawyers, they do not speak the same language when it comes to trauma.
Oh, definitely not. Medically, if I say injury, you're immediately thinking about torn tissue, right?
Yeah.
Or broken vessels, cellular damage.
Yeah, something physical.
Right. But the legal definition, specifically if you look at the Indian Penal Code, IPC, Section 44, is wildly broad. It covers any harm illegally caused to a person in body, mind, reputation, or property.
Wow. Reputation or property. That is a massive umbrella for the courts.
It really is. But medically, when we narrow our focus down to mechanical injuries for you guys, we classify them strictly by the physics of the weapon used. So, blunt force, sharp force, and firearms.
Right, so let's look at blunt versus sharp force. It's basically a sledgehammer versus a scalpel.
That's a great way to put it.
Yeah, like a sledgehammer flattens tissue, right? It dissipates energy over a wide area until things just crush or tear. Whereas a scalpel, well, it concentrates all that force into a microscopic edge to separate tissues cleanly.
Exactly. But the weapon is only half the equation here. The tissue itself dictates the wound.
Wait, really? How so?
Well, it's the fundamental principle of wound production. Soft tissues only rupture when they are stretched beyond their tensile limits, and human skin is remarkably elastic.
Yeah, that makes sense.
I mean, it can absorb a surprising amount of blunt force without actually breaking.
But wait, if skin is so elastic, why do we see blunt force lacerations that look almost like, clean cuts, like when someone takes a bat or a pipe to the forehead?
Think about what's underneath the skin in that specific scenario. Your scalp is sandwiched between a blunt weapon and the rigid vault of your skull.
Oh, right. The bone.
Yeah, the bone acts like an anvil. The tissue is crushed between two hard surfaces, forcing it to instantly exceed its tensile limit and split apart, even without a sharp edge.
Oh, wow. So the bone literally does the cutting from the inside out.
Pretty much, yeah.
That's fascinating. But let's look at what happens when the force doesn't split the skin, but just damages that very top layer, the superficial epidermis.
Right, abrasions.
Basically a scrape.
Essentially, yes.
Mm-hmm.
It's a friction or compression injury to the epidermis.
Mm-hmm.
And for exams, remember they present in four main types.
Okay, what are they?
First, scratches, which are usually from pointed objects like a pin or a nail. Then grazes from sliding friction like road rash. That's the most common.
Yep.
Then there are pressure abrasions, which are crushing injuries. A classic medical legal example of a pressure abrasion is the ligature mark in a hanging.
Oh, okay. And the fourth one?
Impact abrasions. Those actually imprint the weapon's pattern directly onto the skin, like a tire tread.
I mean, that pattern is obviously a goldmine for identifying the weapon. But the color of an abrasion is what really tells the story of time, right?
Absolutely. The timeline is a crucial exam pearl.
So a fresh abrasion is bright red, then it forms a bright scab at 12 to 24 hours, turns reddish-brown by days 2 to 3, and then it falls off by day 7.
Yep, that's the sequence.
But why does it follow that exact color sequence?
It's driven entirely by the breakdown of blood. Initially, you're seeing fresh, red, oxygenated blood. But as hours and days pass, the hemoglobin in that trapped flood degrades into a pigment called hemosiderin.
Okay, hemosiderin.
Right, and that gives you that distinct reddish-brown color. Finally, as the underlying epidermis regenerates, it literally pushes the dried cellular debris, the scab, outward until it just shrinks and detaches.
So you can clock an assault down to the day just by looking at hemoglobin degradation.
You can, provided you don't fall into a major diagnostic trap.
Uh-oh. What's the trap?
You have to prove the abrasion actually happened before the victim died. An antemortem abrasion, one that happened while the person was alive, has to show vital reactions.
Okay, let me guess. Vital reactions just mean inflammation.
Right. Exactly.
Because if the heart is beating, the body is actively sending white blood cells and fluid to the injury site. That causes swelling, which is why an antemortem scab is raised.
You got it perfectly.
Yeah.
The circulatory highway is actively responding to the trauma. Now contrast that with a postmortem abrasion.
Right, like if a body is dragged across gravel after death.
Yes. In that case, there is no blood flow, No histamine release, no white blood cells, zero vital reaction.
So the scab wouldn't be raised at all, it would be depressed.
Exactly.
And the color's completely different too. The sources say postmortem abrasions look yellowish, almost translucent, kind of like parchment paper, but why yellow instead of red?
Well, because there's no active bleeding. The scraping simply removes the skin's protective lipid barrier.
Oh, I see.
And without the circulatory system pumping to replenish moisture, the exposed tissue just rapidly evaporates and dries out.
Leaving a stiff, yellowish, parchment-like appearance, usually over bony prominences where dragging causes friction.
Exactly. No blood flow equals no inflammation, just dried out tissue.
That is a brilliant diagnostic pearl for you guys listening. We've gone from the sprawling legal definition of injury under IPC Section 44 down to the physics of bone acting as an anvil, right down to the cellular evaporation of a postmortem scrape.
It's incredible how much a microscopic change at the surface can dictate the entire medico-legal timeline of a case.
It really is. But before you close your books today, consider this. We rely heavily on that strict timeline of color changes, the hemoglobin breakdown, to date an injury.
Right.
But what if a victim is found in freezing snow or, I don't know, submerged in a highly acidic swamp? How might extreme environmental conditions artificially accelerate or even completely pause that biological clock?
That's a huge variable.
Exactly. The environment alters the evidence from the moment the trauma ends. So keep questioning what you see.